Welcome back. So let's take you back to one of our top stories where United States Secretary of State Marco Rubio has approved an emergency humanitarian waiver for people to continue accessing HIV treatment funded by PEPFAR. It comes after US President Donald Trump halted funding soon after coming to office. Now, this allows for the resumption of life-saving medication to continue being dispersed in 55 countries. The waiver will last for 90 days. Now, South Africa is among the countries receiving funding by PEPFAR. Well, we continue to get response to this now, and for that we're joined in studio by Sisonke National Movement Communications Officer Yonela Sinqu. Yonela, good evening to you. Thank you so much for joining us in studio.
Thank you for having me, Naledi.
We appreciate it. We also are joined by Mia Malan, who is the founder of the Bhekisisa Centre for Health Journalism. Mia, good evening to you, and thank you so much for joining us. Really appreciate your time. So, Yonela, I'm going to start with you because you're here with us. And obviously, a lot of the discussion this morning, before this announcement of this waiver came, was, my goodness, what are we going to do, particularly for vulnerable HIV and AIDS patients that need to be accessing medication? Are we going to be seeing a massive shortage in access to medication? And then this waiver. So I think, give me, the sort of response that you have from, pre the waiver, and if you think that waiver is a little bit of reprieve.
Look, for us, this was a shock. It is not something that we had anticipated. And it was a big nightmare that we had to now take control over, because this PEPFAR-funded and USAID-funded clinics were servicing vulnerable groups that are already isolated and marginalized in our communities. So to wake up and have an announcement that they will no longer be serviced is a big shock for us, and it is a big frustration. Yesterday, there were queues on end at WRHI clinic of individuals trying to access healthcare, and others were still scurrying this morning saying that, where do I get my medication, what do I do? So it is a big frustration for everyone, and having the relaxation of the waiver to a point this evening, it's still nothing to us, because really, what does life-saving medication mean? What does it mean? Because it is very vague. Because here the focus is only HIV treatment, but what about the psychosocial support, which is in line with the treatments that the people are getting? Yeah. And what about the vulnerable children and the orphans that we're getting support? So this not only touches on HIV, but on a bigger spectrum. There's also the healthcare workers that are rendering services to these people. What is going to happen to them? So we are all pulling our hair out. We're all trying to find solutions to this, but having to find a solution overnight on a 20-year program, it's totally outrageous.
You did, of course, have the health minister earlier saying, while, the health budget spend, I think he was talking about HIV treatment, is 46.8 billion rand, and about 17% of that is what makes up aid, right? And that's an interesting number, because even just under an hour ago, Mia, in conversation with Minister in the Presidency, the spokesperson of the Presidency, rather, Vincent Magwinya, also touting those numbers and saying, well, to some extent, South Africa is able to sustain itself. But I almost want to get the initial response to Trump's executive order and just how far-reaching it actually is, in your understanding, to the health sector in South Africa, Mia.
Well, in South Africa, as you've mentioned, the health department has put it on record that we pay for all our HIV treatment ourselves. So our problems are not the pills. But as the person from Sisonke now mentioned, the PEPFAR fund does fund many other things, like salaries of health workers, or, the distribution costs of pills. So just having the pills in a box somewhere doesn't mean it can get to people. Now, I think the thing about these executive orders is that it's been done in a very cruel and inconsiderate way. So the organizations that have received stop work orders had to stop. Now there's a waiver, and as you've heard, there's no clarity around that waiver. They didn't issue a list of medicines along with it to say, we consider the following medicines as life-saving. So maybe they consider HIV treatment as life-saving, but you can use the same pills as prevention, as an anti-HIV pill for someone who hasn't been infected yet, who wants protection. No one knows if your clinic does that service, whether that would count or not. So there is a lot of confusion around these things, and it makes people very, very anxious. Now, the same organizations, whether you qualify for a waiver or not, all these organizations have been told you will be re-evaluated to see if we actually do want to continue to fund you. And the confusion around that is immense because no one knows which metrics will they use to be evaluated. It seems at this stage that they're not going to be evaluated whether they're effective or not. They're going to be evaluated to see if they align with the Trump administration's ideologies. And that ideologies involve being against abortions, not supporting transgender people, which is absurd within the context of HIV. Transgender people are more vulnerable. They have a higher chance of getting HIV. So science tells us we need to give them more resources. But this administration wants to do exactly the opposite, and none of their decisions are based on science.
Yeah, you know, there's a lot to look at because just this week, Yonela, we had one of our reporters in the Eastern Cape in Nelson Mandela Bay looking at 3 health facilities there. And just the massive problems that you're seeing, staff shortages, in fact, staff going on strike in that area because they are facing so many challenges, deteriorating infrastructure. We even were able to get footage of piles and piles of expired medication in one facility. And the challenges go on and on and on. One hospital that was, struggling with access to water, for instance, and that being a complaint that was being given to us by some of the staff. So then you bring in the resources that come in from PEPFAR. What that does to those sort of facilities, Yonela?
You know, these clinics are actually a relief to our healthcare system because a lot of our clinics and hospitals were built pre-1994 and they catered for a very small number of people. And today we are seeing an influx in urban areas, and those clinics don't expand. The number of staff does not expand, and we are sitting with people with qualifications that are not being employed by those clinics. So having these private donor-funded clinics is a big relief. And also, when we're dealing with key population, our clinics don't cater a lot of the time for those key population groups. For instance, our clinics don't give homotherapy for transgender individuals. And we have clinics that are specific for those people. And for instance, sex work clinics that are tailored for sex workers' needs that will go out in the evening to go and reach sex workers at their sites because sex workers can't go to the clinic either during the day or they are more comfortable being at the spot where they are at rather than going to the actual clinic. So those aids being taken away, it is now going to put us back. And we understand that sex workers are more susceptible to transmit HIV more than any other normal person in the country. And they are very cautious of that. They understand that. So if you're going to take away USAID and PEPFAR-funded clinics, that means you're also taking away prevention, which is the condoms that they use and that they access. And you go to some state facilities, they will tell you there are no condoms. So we have always ensured that through our partnership with these donor-funded clinics, that our members are well taken care of. And now to just take it all away overnight, it is really not a humanitarian act, and it is a human rights violation because you are depriving people of their right to access to healthcare. Do
you think that this sparks a different? I'm going to stay with you here, Yonela, a little bit, because there is the conversation taking place in the US about, and you talk about transgender rights, and Mia even mentioned, access to abortion and such. There is, of course, the question on whether or not this is going to start that very, divisive debate here in South Africa, not just for health facilities, but at a broader scale as well, where you've got to start looking at, well, we might have a shortage of resources. Who stands at the front of the line?
You know, this is work. This is progress being undone. You know, by one individual. We have moved so progressively in our country, in our constitution, to actually recognize marginalized groups such as transgender people, and we have moved so much to recognize individuals such as sex workers, and we've done our best to reintegrate these individuals into society, and now to further marginalize them by depriving them of health care. We are going back because this is now also a psychosocial support issue. That who is going to offer psychosocial support for these individuals if you're taking all of this away? So if we are looking at just HIV, access to HIV treatment, that is a very narrow-minded way of looking at things. Yeah. Whereas we're looking at people holistically.
Yeah, I want to read from the waiver. The waiver does not apply to activities that involve abortions, family planning conferences, administrative costs, gender or DEI, so diversity, equity and inclusion ideology programs, transgender surgeries, or other non-life saving assistance. So the U.S. foreign aid pausing that $1 billion of life assistance having a far-reaching impact. And Mia, you've talked a little bit about that. Are there opportunities, though, from the resources that South Africa has for us to cushion all of the gaps that we see here in this waiver, certainly in the next 3 months, because 90 days is also a short period of time. And then there's after that 90 days. What happens after that 90 days when even the waiver is lifted and we go into the full implementation of that executive order by Donald Trump?
So the waiver says that, as you've heard, that clinics, for instance, that provide transgender services do not qualify for that. And it's interesting that all the clinics we've heard from so far in South Africa that have received orders to stop working, that they also serve transgender populations in addition to men who have sex with men. But if you ask about the gaps that can be filled, well, South Africa is in a better position than other African countries in the sense that we buy our own medicines. But that money that we now won't have generally mostly goes to civil society organizations who, for instance, provide some nurses for clinics in the government and help with distributing or administering HIV treatment. Now, our health minister has said that he's going to talk to the finance minister, but getting that amount of money overnight is simply just not doable. You know, it's possible to close down a clinic overnight, but building it up again does not happen overnight. It takes a lot longer. And what happens with this is trust has now broken down. What if PEPFAR comes back, say you have a waiver now, are you going to stay open or not? It does say that 10 February is the deadline for the US government, so I would imagine PEPFAR officials to reevaluate programs to see if they will continue to be funded or not. No one knows. The short answer is no one knows what's going to happen. What rules will be used when they get evaluated? Will they, how many will be closed down? What will they be measured against? So it's very, very hard to say what will happen. All we know is by 10 February, the Trump administration has said there will be decisions and these projects will know, are you going or are you staying? Or are you staying, but you have to drop a few services because we don't agree with some of it, because we don't like some of the groups of people that you work with. And I think we have study after study that shows us, if you want a disease to spread, if you want to be guaranteed that it spreads, go and discriminate against people. Because once you discriminate against a group of people, they become scared to go to a health facility. They don't feel comfortable and they don't access the services that they need to access. And HIV is an infectious disease. If it spreads in one part of the world, it inevitably reaches the other part of the world. When you interrupt HIV treatment, people become resistant. They develop forms of viruses in their body that no longer works for the same cheapest effective treatment that they were on if they were on first-line treatment. the kind of virus they then transmit to others is the virus that is resistant. It means the person who gets infected will right from the start not be able to use first-line treatment. And people travel. That resistant form of that virus is eventually going to reach countries like America. So there are many indirect consequences for America itself from discriminating against the rest of the world.
Now, let me stay with you, Mia, because you make the point around the trickle-down effect. And, Yonela earlier was talking about, so it's not obviously just going to be the medications that are impacted, but we need to get information to the most vulnerable communities. And then when we're starting to prioritize services, there is the issue of where communication to vulnerable communities starts to fall by the wayside. I think about some of the work of Bhekisisa, for instance, in being able to keep people informed about what is happening in the health sector. And if that's a concern, you made the point around for disease to spread, these are the elements that need to be in place, and discrimination is one of them. I imagine a lack of communication becomes one of them as well.
Yes, communication is incredibly important, and communication is a large part of what PEPFAR is funding in South Africa. They help to fund campaigns that create demand, that make people aware of ARVs and create the demand to actually use them. But also there's another side to it. There is an injection that you take once every 6 months. It's called lenacapavir, and it virtually wipes out your chances of getting HIV. In late December, PEPFAR, along with the Global Fund and other donors, made an announcement that they are prepared to fund 2 million doses to countries like South Africa and other low and middle income countries to get this injection to countries, because it can really be a game changer in our journey onto ending AIDS. But the person who headed up PEPFAR then was not a Trump person. That person will be replaced now. So the question many activists now have is, can the new person that Trump will appoint just overrule the previous announcement? And will the developing world just never have access to this unaffordable at the moment injection that could really slow down the spread of AIDS, change the course of direction? No one knows what's going to happen with that now. PEPFAR announced in July last year that there's another injection that you take once every 2 months that also works exceptionally well, that they would donate 200,000 doses to South Africa. People in the health department in that world are pretty convinced it will just be cancelled. We don't know yet. They haven't announced it, but will that be considered life-saving medication? It's prevention. You just don't know what kind of science or non-science the Trump administration will use for those arguments at this stage.
Sure. There's a lot to talk about, but Yonela, I'm going to give you the final bite here, and that's to say to the authorities that are listening, 3 months' time, that waiver will disappear, and it exists right now with the limitations already that are in place. Your call to action for the Department of Health.
Our call to action is to accelerate treatment for our people. And treatment is not only limited to access to ARVs, but we need to consider mother-to-child transmissions. We need to consider children that are going to be born to HIV-resistant parents. And we're already sitting with a large number of orphans as a result of HIV-related deaths. So we cannot afford to be relaxed about this matter. We have called for more than 20 years to get to where we are for the access that we have. And for it to be kicked down overnight, we cannot sit back and relax. We need to be more vocal about what we are saying and more intentional about what we are saying, and not just wait for the 90 days to expire. But we need to be proactive in our response to HIV and other diseases, because this not only touches on HIV, but we're also battling TB in this country, which is more deadlier at this point than HIV. So as a member of civil society, we are saying that we shouldn't wait for the 90 days. We need to use as many resources as we can and partner with other countries to stop this, because this is utter madness for people to just be left to death and wait for a 90-day waiver, which we don't know. And there's no clear lines as to what measures are going to be used. And then what happens after 90 days if the waiver is now retracted, and then we are sitting back before the waiver. So,
yeah. Thank you so much for speaking to us, ladies. It's been an absolute pleasure speaking to you, and we'll continue to engage as the developments continue. Yonela Sinqu, the Communications Officer at Sisonke National Movement, thank you. And Mia Malan, Editor-in-Chief of Bhekisisa Centre for Health Journalism as well, and she's speaking to us live from Cape Town.